But what I'm worried is that we're not using those 21 days to do all the right things. So you have to understand that the lockdown won't cure the society of the virus. The virus will still be there. It'll just bring the infection rate down.
Right.
The moment you let the lockdown go, the infection will come back. So the question is, why are you doing the lockdown, and what are you trying to get out of it? And you want to do two things. You want to spread those infections out, but if you don't want to have to do another 21 or 28-day or 49-day lockdown 2 months from now, you need to use the current time wisely.
Right.
And the two most important things that India and Pakistan and all of South Asia needs to be doing is, one, substantially increase testing. You need to be testing large numbers of people. This is what South Korea did. And you need to be identifying people who are infected, and you need to be isolating them.
Right.
And second is, you've got to be getting your healthcare system ready. PPEs for doctors. I know there have been a lot of complaints in India about the quality of the PPEs for doctors and nurses. Again, if doctors and nurses start getting sick, they just will stop coming to work. It's going to be a disaster. So both of those things are very, very important, and I want to make sure that the Indian government and the states are working on expanding those two issues. Otherwise, it's going to be a huge challenge.
Do you think India is currently ready, Dr. Jha? Do you think they are enough prepared with whatever measures they're taking right now, with the quarantine, with the vaccine trials they're also doing amongst themselves? Your take on, will India be able to combat cases as high as the United States if that happens?
Yeah, so I'm pretty worried that they will not, and that the number of cases in India will end up surpassing maybe any other country in the world. And while, again, I think the lockdown is a very good idea, very supportive of it, I don't see enough happening on how India will be able to open up and stay open. And it'll be very hard politically to do another lockdown. And you don't want to waste the lockdown. So you want to use this time wisely. And when I'm looking at the data coming out of India, talking to people who are in the leadership there, I don't think that the Indian government is using this time as aggressively, as effectively as it needs to be. And I'm very worried we're going to see a large increase in cases, maybe not in this summer, but certainly into the fall.
And in terms of just discussing a little bit more of that, you know, we're looking at such troublesome numbers, Doctor. We're looking at, you know, us really not knowing what's going to happen next week. How do we truly hunker down? The entire problem is the fact that people are still outside. People are still not obeying social distancing. How do we really control the situation, especially when you're looking at huge countries such as India or the United States?
Yeah. So a couple of things. I mean, first of all, for people who are not doing social distancing, people who are still going out, still socializing, you have to understand that you're putting yourself at risk, you're putting all your family at risk, and all the work that everybody else is doing, staying at home, you're making it less effective. So it's incredibly selfish for people to be not social distancing right now, and they need to cut it out and they need to stay at home. That's message number one. Message number two is what I suspect will happen is when number of cases spike in communities where social distancing is not happening, governors will turn this into legal action where they'll have to enforce it with the police or even the National Guard.
Yes.
I don't want to get to that point where we're having to have police enforce, but that is where I suspect we may end up going, especially in communities where people are not taking it seriously. In India, of course, this is a huge challenge because we have large migrant populations. You have a police force that is not necessarily all that trusted to do these kinds of things.
Right.
So India is going to have a harder time enforcing social distancing, meaning it will be less effective, meaning that there will be more of a risk of a case, you know, of serious disease outbreak. And that makes the testing issue even more serious, because I don't think social distancing is going to work as well in India for all the issues, all the reasons I have outlined.
So, Dr. Jha, in that case scenario, what do you require from our administration right now if we want to really, make the situation better next week, be better at just holding our hospitals to a capacity that they can treat patients? What are we calling at the administration for right now? According to you, where do we have to work? Is it local? Is it state? Is it federal level? According to you, where do we need to right now focus on?
Yeah, great question. So right now, there are two tasks, two jobs ahead of us. Job one is getting through the next 4 to 6 weeks. Job number two is preparing for the summer and fall.
Right.
So for the next 4 to 6 weeks, we have to be doing three things. We've got to keep everybody at home. There's still states that haven't fully implemented a stay-at-home order. It's crazy. Every state should be doing that.
Right.
And every community should be enforcing it. And if you know people who are not staying at home, you should call them up and tell them to go home. Second is, I know I've said this several times, our testing infrastructure in the U.S. is still not where it needs to be. Still too many people who can't get tests that they need. We need to ramp that up. And third is, right now, the federal government, all the state governments have to be focused like a laser on making sure there are enough ventilators, making sure there are enough PPEs, personal protective equipment for doctors and nurses.
Right.
Because I am very, very worried that doctors and nurses are going to start getting sick in very high numbers, and you're going to have the whole healthcare system collapse because there are not enough doctors and nurses. That's what we need to do in the short run.